I'll give everyone just another minute to grab a seat, please. We'd love to have you for this chemo moment. So today I have the most amazing and daunting task of introducing somebody who I consider a friend. How can I introduce somebody as wonderful as Mariano Gimenez? How can I introduce somebody that is so kind and honest? Somebody whose friendship I value so much. Well, that's the task I have today, and it is daunting. I've been so nervous about this, I actually couldn't sleep many nights because I wanted it to be perfect. For the man who's become one of my closest friends and confidant over the last year. Where do I begin? Well, I think we must start at the beginning. Mariano was born in Buenos Aires, and I think we always need to give credit to those that created us, and that's Mariano's parents. And here I have a picture of his loving mother, who was a homemaker, and his father, who worked hard to take care of this family. His father was in the army during the time of the Peron era and may have perhaps inspired the travel bug that plagues Mariano to this day. He finally worked as a manager for Fiat, a car that we had a lot in Zambia when I was growing up. And we must always remember that we are what we are because of our parents. He gave him the ability to love and be passionate about one's work. And his mother was always there and gave him the knowledge of how important family is. Well, Mariano always wanted to be a surgeon, but from his earliest day, I met his lifelong friend Tuco, which I understand means red spicy sauce, was with him during school at Manuel Belgrano, and they formed the power band that is shown over here. You would have thought that playing guitar was more his style, as you can see from his photo. And just in case you're wondering who Mariano was, this is him. He also was quite the 70s and 80s role model. And again, you can see him enjoying life. And this is Mariano, because I wasn't quite sure who he was in these pictures. Thank you, Tuco, for pointing it out. Mariano was also quite the model, as you can see, and I'm not quite sure what was going on in that right picture, Mariano, but apparently dressing up as a baby was something too, as you can see over here. This is Mariano, the model. As you can see, again, with his lifelong friend. And you can see that Mariano enjoyed his early life well. Well, Mariano's dreams came true, and he went off to medical school in Buenos Aires, as you can see over here, and then residency at the University Hospital. Here. And he was lucky to study under somebody that was very influential for him, Dr. Pereira, who regarded, and I think Mariano regards him as one of his key mentors. It was there that he met his lifelong friend, there was Dr. Hugo Garcia, and also Dr. Octavia Gill, who is here today in the audience. And then the most important thing happened, where he met Mariana, the love of his life. She was studying at the University of Buenos Aires and was planning to move to California for further studies, but was struck by the outstanding charm of Mariano. And they wed soon after in 1989, so just 2 years before we wed. Mariano was always interested in innovation and sought the opportunity to develop image-guided techniques and got the travel bug back then. Here he is seen in Los Angeles during one of his stays in the US. It was also during this time that he met his lifelong friend, Horacio D'Agostino, who's also here today, and they created a lot of hell in percutaneous surgery together. And these are some of the first meetings that they had. He then returned back to Argentina and used his amazing skill set to develop a department of percutaneous surgery. And here we see him at work. And then true life began with his 3 children, who I've got to know really well and consider part of my family, and have sort of inserted myself into theirs, unfortunately for them. But we too have 3 children, and it's lovely to have Felipe, Ignacio, and Azul and their partners here today. Again, having 2 boys and a girl myself, this is really lovely to see. Mariano worked in a newspaper and has been a consultant to allow Mariano the flexibility of what he has had to do with those crazy hours. Thank you for always supporting him, Mariana. I wanted to, and this looks just like my kids playing video games. I wanted to, you can see that they always travel together. Again, such a lovely thing. And it's the party house where everyone comes. I wanted to tell you a brief word about each one. I had a chance to speak to each of Mariano's children. Felipe is the oldest and a diplomat, and is here today with his lovely wife. He remembers that his father loved photography, and like my children that are scrolling through my phone, will see the occasional liver resection pop up. He got his love for traveling and is a successful diplomat as he travels the world here. Ignacio now lives in France, and it's the same country where Mariana and Mariana are, and he's there with his partner. He remembers sailing with his dad and playing truco, a card game. He's an MBA entrepreneur, much like his father, with an innovation bug. Azul, just like my own youngest, is a lawyer, and I bet she can get anything out of her dad. My daughter can. She remembers the lovely Sundays that the family spent together eating thick crust pizza and watching movies. And she also got a desire to do what's right, always, like her father. She will always fight for those that don't have the voice. And we so appreciate that. She loves these dinners that they had as a family. Sounds like political discussions like around our table. So what about Mariano's professional life? Well, he's a major innovator and a director. I also wanted to say, Mariana, you are everything. And these photos just capture the love that you have for each other, which is so wonderful and actually not that common, unfortunately. And thank you for that. He set up a department, again, these are the family all together. Eduardo Houghton is his colleague and friend in Argentina, and I think they work so well together because they understand each other and can continue each other's sentences. Mariano has set up percutaneous technique places everywhere, and this was his initial team. He loves to travel, as you know, usually first class. I'm envious. And you can see he likes to dress up still. Well, he was recruited to Strasbourg by Jacques Marisco, who is here today and has been such an important friend and colleague for Mariano. He spent much of the time in Strasbourg at ERCAD, and so there have been 2 constant themes in his life: innovation and travel. And this is Jacques Marisco. You can see Mariano setting up some of the courses today, and you will always know that this is the man that will innovate and change and move forward. He's never afraid to do what's right. He's never afraid to fight for his patients or his family. And I think the words of Truco ring true over here. But if there's one thing Mariano has mastered beyond medicine, it is the art of friendship. Because beyond his academic achievements, his leadership in this prestigious organization and his relentless pursuit of innovation in the field, Mariano has always been the ultimate host of our best gatherings, the architect of our most memorable conversations, the grill master who, with a bit of smoke and a bit of love, has not only fed our stomachs, but nurtured our bonds of our friendship. He's also represented the AHPBA so well, as can be seen with many of the other presidents. And today, I'm so humbled and thrilled, and probably this is going to be the highlight of my career, to introduce your president, Dr. Mariano Gimenez.
Wow. Well, dear friends and colleagues, it's an honor to be here. It's good this time because I need quiet. When you say this, okay? The previous one, please. Thank you. It's an honor to be here. It is a very special moment for me, possibly the most significant in my professional career. I would like to begin by expressing my gratitude to my friend, brother, Rohan, for his warm presentation. His friendship and support have been key over this year. Thank you. Thank you to those who trust me to be in this place, in particular, Tim Pollack, Gassi Sibari, Felipe Coimbra, and my friends of many years, Javier Lenduar. To my colleagues during these 4 years in the management of our society, Mike D'Angelica, Magella Doyle, Sean Cleary, Rohan Chesharaha, Shimo Shah, and Tara Kent. Thank you for sharing this journey and for your patience with my English. To all the members of the Council, the chairs and members of the various committees, thank you for your tireless work. And a special acknowledgement to the Program Committee for the outstanding meeting you have organized, led by Flavio Rocha and Susan Warner. It's a pleasure to work with you. Really, we are very happy because this meeting is the meeting with more attendees in the history of the AHPBA meeting. For that reason, thank you for your incredible work. To the President of the Latin American chapters of the AHPBA, and especially for the new chapter of our society in the Dominican Republic, and to all the colleagues from Argentina and other Latin American countries who accompany us. To Jill and Margie, whose work allows our society to grow every day. Thank you for supporting each new idea and each new challenge. Thank you very, very much. Thanks to the international HPV officer, especially to this President, René Adam, to the chair of the 2026 International Congress Program, Itaru Endo, and to all the international professors who have come to share their expertise. Thank you all for being here today. In sincere acknowledgement, we have named 4 past presidents, Henry Pitt, Mark Callery, Wright Pinson, and Scott Helton, and as honorary members of our society. We want to thank you for your support and for your inclusive vision. Following the example of past presidents, we have continued to support academic quality and training. So, among other action, we have added 2 hands-on courses at the beginning of this Congress, robotic and cholangioscopy, that have been a success with full occupancy. They complement the other 2 successful courses of ultrasound and ablation. We want to thank you, the director and faculty who made them possible. We also reaffirm our commitment to the diversity in HPB surgery, not only as an ethical obligation and justice, but also as an opportunity for innovation and progress. Therefore, we have formed within AHPBA a multidisciplinary group that brings together surgeons, endoscopists, radiologists, oncologists, and other specialties to address together the complexities of HPV pathology. Today, more than ever, we must leave behind the idea of I am and focus on what the patient needs. Perhaps soon, the traditional notion of departments, surgery, gastroenterology, radiology, will be transformed into teams of specialists dedicated to one disease or organ. And our organ-focused society can pioneer this change. In addition, we must work not only on training in new technological advances, but also in new form of leadership, more modern, more inclusive, capable of integrating others. With this in mind, a group of surgeons, radiologists, and endoscopists from the whole continent started an experience the last year known as Next HPV Care. The idea is to train future HPV leaders in Latin America, including several young specialists from 14 countries united by the treatment of HPV conditions. For the first edition, we select 50 physicians out of 764 applicants. Today, 25 of them are here. Due to the success of the first experience, this year, we are carrying out a new program. Each year, the president of our society presents in this place a topic that he believes to be a priority and of interest to the members. Today, I will talk about the democratization of HPV surgery in the age of technology. Technological advances in medicine in general and in HPV in particular are incredible. High-quality 3D images have allowed earlier and more accurate diagnosis and therefore better treatment. In the same sense, we have learned that we can and should use them in our surgical practice. Nowadays, we can visualize high-quality preoperative images in 3D with artificial intelligence software to evaluate resectability and plan the surgery. Recent work demonstrates the advantage of this planning compared to classic CT or MRI images. Similarly, today, we can simulate surgeries and the position, for example, of our trocar prior the laparoscopic or robotic surgery. Once in this intraoperative setting, the fusion of images through augmented or mixed reality allows the transparency of the skin and solid organ, showing the relation of the tumor with, for example, vascular element. As organ move during surgery, the natural evolution of this technology is toward dynamic augmented reality. Although this is an important step in the evolution of imaging in surgery, it requires very complex computational power to sustain it in long and complex surgeries without having to keep updating the relation position of the tumor and the anatomical landmarks. Second, another way out of this question is the Japanese engineers and physician surgeons have developed artificial intelligence software that located anatomical landmarks and highlights them during surgery. I consider this to be a great step forward. Unfortunately, in cases of bleeding, significant inflammation, or in obese patients, where these advances will be really useful, the artificial intelligence might not recognize anatomical landmarks and may not provide sufficient information. This development also allows us to use optical, electromagnetic, or robotic navigation guide during our surgeries. Another advance in imaging is the possibility of outcome monitoring during our surgery. An example of this occurred in Buenos Aires, where non-rigid fusion of images during hepatic tumor ablation confirmed the correct ablation zone, achieving results comparable to surgical resection in selected cases. These advances are examples of computer-assisted surgery. All the surgery we perform and will perform this century will be marked by this concept. The definition of computer-assisted surgery is the broad use of technological to enhance surgical skills and augment their sense, image-guided surgery, cognition, deep and machine learning, and execution with the robotics, in order to provide more precise, simple, and safer surgery. When I refer to augmenting our sense with image-guided surgery, I am talking about the ability to introduce layers of information through our eyes, since when operating through a screen, whether in laparoscopic, robotic, percutaneous, or endoscopic surgery, more than 90% of the information that reach us is visual. In this way, we can increase the vision of the light spectrum, and a good example of this is in the oceanic ring. And currently, what is known as hyperspectral imaging, which complement ICG, allowing us to visualize element and perfusion of organ without injecting any drug to the patient. I believe that the combination of both will be very useful in the near future, since we could use ICG preoperatively to localize, for example, tumor in the liver, and hyperspectral vision to evaluate perfusion and segmental or subsegmental anatomical localization. Continuing with the concept of image-guided surgery, as we have already seen, we can use mixed or dynamic reality to make solid organ transparent. On the other hand, AI during surgery allows us to go beyond visualizing elements. It can inform us we are on the right track during our procedure, increasing our own cognitive power. An example of this was developed in Strasbourg. In this laparoscopic cholecystectomy performed by Professor Mutter, AI confirmed that we had performed the 3-step of critical view of safety. In the near future, artificial intelligence will be able to write our operative report as a quality control measure and will open the door for partial or full automation of our surgeries. Finally, computer-assisted surgery allows us to increase our performance capacity through robotics. Robots are the natural evolution of surgery. The incorporation of the images and AI elements mentioned above equalize skills so that more surgeons will be able to perform complex surgeries in a minimally invasive way. Robotics enables the concept of telesurgery, first performed by Professor Maresco in 2001, and he's prepared the field for partial or total automation. Moreover, costs are being reduced as a result of an increasing number of robotic companies, which has grown from 1 to more than 100 in the last 5 years. There is no doubt that the future will soon be robotic. In this context, where innovation and technological advances have caught up with us, the concept of democratization in surgery become important. A first approach to the subject occurred when it became clear that technological allowed beginners to have similar technical results and experts when they use it. One of the first scientific papers on this subject was carried out by one of our fellows. In a simple experimental study, he demonstrated in 2018 that inexperienced physicians could have more accurate results using electromagnetic navigation guidance than experts, like me, using classic methods. Later, multiple studies on patients showed the same results. Using advanced technology, the technological results were equalized between beginners and experts. For this reason, the use of technology to equalize technical results began to be known as the democratization of surgery. This is a good thing because the number of experts is always limited, and being able to widen the results for more surgeons will allow the provision of better medicine to more patients. Of course, this democratization between beginners and experts relate only to technical skills and not to the medical judgment. For example, machine cannot decide when to take one course of application over another or resolve complication during surgery. Medical judgment is gained by experience and training with surgeons with criteria and common sense. But for the concept of democratization of surgery not only relate to technical skills, it must also be accessible, affordable, and widely available. Thus, we could define the democratization of surgery as the process of expanded complex surgical care, overcoming geographic, economic, and social barriers. This is achieved through technological innovation, advanced training, and infrastructure improvement, ensuring high-quality surgical interventions for more people. In terms of technological innovation, on an annual basis, CB Insight published a ranking of the top 100 AI startups selected from more than 7,000 companies, reflecting the growth and scale of the artificial intelligence ecosystem in healthcare. According to the BBVA report, 122 startups in the health tech sector have reached unicorn status, value of over $1 billion. This data reflect a dynamic and expanding ecosystem with thousands of startups emerging and evolving at the intersection of artificial intelligence and medicine. Similarly, robotic and image-guided surgery through hybrid operating rooms allow qualitative leaps, but at a significant cost. The increase in the number of surgical robots companies with a specific application for certain surgeries allow for a better management of resources and decrease in cost. More and more hospitals in the next 5 years will have robots in large and medium-sized institutions in all continents. Hybrid operating rooms that integrate high-precision imaging equipment, CT, angio-robot, MRI, with conventional surgical technology, allowing percutaneous robotic and open procedures in the same environment, require cost and size only available to large institutions. Therefore, we are working in Strasbourg on the short project, a smart hybrid OR with ultrasound, allowing the creation of low-cost hybrid OR with very similar performance. This is achieved thanks to the new high-resolution ultrasound scanner with elastic fusion of images and navigation guidance, in addition to high-definition C-arm radioscopy interconnected to an ultrasound scanner and eventually to a robot. Ultrasound with the support of AI and augmented reality is the way to achieve this technological revolution at lower cost. Risk. These revolutionary changes in surgery generate a paradox. While technological expand our capabilities, it also pose significant risk. One of them is the loss of critical thinking, especially in the new generation of surgeons, who could become overly dependent on artificial intelligence, not only to optimize their work, but to delegate it completely. AI is a powerful tool, but its indiscriminate use can stunt the capacity for analysis, clinical judgment, and even surgical imagination. Are we at risk of training highly assistant surgeons, but with less capacity for abstraction and complex problem solving? Another risk is a falling in love with technology and losing our professional focus on our patients. Technology is a tool, not the goal. According to the World Economic Forum, the biggest barriers to the adoption of new technology are not economic, but a lack of leadership and understanding of their potential. As a surgical community, our responsibility is not only to adopt technology, but also to integrate it wisely. But the technological development also offers us opportunities and challenges. We have explored how technology is redefining HPB surgery, how artificial intelligence, robotics, and computer-assisted surgery are expanding our capabilities and shortening the learning curve. But the key question is not what technology can do for us, but what will we do with technology? Progress is unstoppable, but its impact is not uniform. Surgeons who embrace innovation, who adapt and lead these changes, will be the ones who shape the future. AI robots and image-guided surgery will not replace surgeons, but we need to be able to use these techniques. Otherwise, we will be sidelined. Carlos Pellegrini compared our profession to a journey in turbulent water. But we are not alone. We are in the same boat with colleagues, mentors, trainees, all rowing in the same direction: surgical excellence at the service of the patient. We do not choose in which era to be surgeons, but how to be surgeons in this era. And today, at this fascinating moment in the history of surgery, we must decide: will we be witness of change or architect of the future? To conclude, today, I want to pay a special tribute to those who have been my guides on this journey, my three mentors: Santiago Pereira, Horacio D'Agostino, and Jacques Marescot. A mentor is not just a trainer, nor someone who facilitates opportunities. A mentor is someone who has the vision to anticipate changes, the intelligence to understand the environment, and the infinite generosity to share it. I have been fortunate to have three outstanding mentors. Two of them are with us today. Thank you, Horacio and Jacques. The first of my mentors, Professor Santiago Pereira, is sadly no longer with us, but his legacy is present in each of his 5 disciples. Today, 2 of them are here. Hi, Octavio. And the testimony of his daughter, who shared a few words with us.
My father, Santiago Guillermo, had 2 great loves, his family and his profession. His passion for surgery and teaching remained steadfast throughout his life, even until his very last days. He trained tons of surgeons, but among them, there were 5 who were his disciples, mis muchachos, my boys, as he used to call them. Mariano was one of them. My father was impossibly severe with them, but at the same time, he was utterly convinced of their capacities and potential to become leading surgeons, both in Argentina and abroad. In fact, by the end of his life, he was so proud of their high positions in different surgical services. It is comforting and rewarding for us, his family, to see his legacy in his muchachos. So thank you, Mariano, for keeping my father's memory alive.
To the entire IRCAD family and my team at the Daicin Foundation in Buenos Aires, my sincere thanks for your dedication and commitment. To my lifelong friends who have traveled all the way from Argentina to be here today, organizes their work to accompany me at this moment. More than 50 years of friendship reflect what matters in life. Thank you from the bottom of my heart. Finally, to my family, my dear wife, Mariana, and my children, Felipe and Vicky, Ignacio and Sophie, and Azul and Man. Your unconditional love and support have been my driving force. The future of our profession is in our hands. Let's continue to drive excellence, innovation, and teamwork so that HPB surgery continues to advance in the service of our patients. Thank you all for being here. It's an honor and a privilege to share this journey with you. Thank you.
Thank you all very much. We'll take a break. Please speak to the exhibitors. Thank you.